Today I'm going to talk to you about anatomy and some anatomical vocabulary. First, I'm going to show you is the anatomical position, which are feet side by side, facing forward, close together, hands out to the side, palms facing forward, standing upright and looking to your front. And this is the anterior view of the anatomical position. The next three things I'm going to talk about are the three planes of motion. So I will explain the plane of motion and then I will have a demonstration of it as well. So the first plane of motion I'm going to talk about is the frontal plane, which basically divides the body straight down, if you think to be cut right down the center there. So it would split you into an anterior and posterior side, or front and back. The second plane of motion I'll tell you about is the sagittal plane, which if you go straight down through the medial of your body, it divides your body into a right and a left side. The third plane of motion is the transverse, which cuts through the body, separating it into an upper and lower half. The body's broken up into 5 main regions. We'll start at the top and we'll work all the way down. So starting at the top is your cephalic region, which is your face and your head. And in your cephalic region you have your cranium, which is superficial to your brain. You have your orbitals, which are lateral to your nasal. And you have your oral, which is medial to your otic. Going down to the neck, you have your cervical. And in your cervical, you have your throat, which is anterior to your nuchal. Moving down to the trunk region, you have your heart, which is deep to your sternal. You have your navel, which is inferior to your pectoral. And then you have your spinal column, which is posterior to your abs. Moving to the upper limbs, we have our palmar, which is distal to our carpal. We have our brachial, which is proximal to our antebrachial. Going into the lower limbs, we have our femoral, which is anterior to our sural, and we have our patellar, which is superior to the dorsum of the foot.